Pleurisy pleuritis. Introduction. The pleura is composed of two layers of thin lining tissue. The layer covering the lung, visceral pleura, and the parietal pleura that covers the inner wall of the chest are lubricated by pleural fluid. Normally, there is about 10 to 20 ml of clear liquid that acts as a lubricant between these layers. The fluid is continually absorbed and replaced, mainly through the outer lining of the pleura. Pressure inside the pleura is negative, as in sucking, and becomes even more negative during inspiration, breathing in. The pressure becomes less negative during exhalation, breathing out. Therefore, the space between the two layers of pleura always has a negative pressure. Definition. Pleurisy, Pleurisy, is a condition in which the pleura, two large, thin layers of tissue that separate lungs from your chest wall, becomes inflamed. It is also called pleuritis. Pleurisy causes sharp chest pain, pleuritic pain, that worsens during breathing. Pleurisy is an inflammation of the pleura, which are the lubricated linings between the lungs and the chest wall. Causes. Pleurisy can be caused by any of the following conditions. Infections, bacterial, including those that cause tuberculosis, fungi, parasites, or viruses. Inhaled chemicals or toxic substances, exposure to some cleaning agents like ammonia. Collagen vascular diseases, lupus, rheumatoid arthritis. Cancers, for example, the spread of lung cancer or breast cancer to the pleura. Tumors of the pleura, mesothelioma or sarcoma. Congestion, heart failure. Pulmonary embolism, blood clot inside the blood vessels to the lungs. These clots sometimes severely reduce blood and oxygen to portions of the lung and can result in death to that portion of lung tissue, termed lung infarction. This, too, can cause pleurisy. Obstruction of lymph channels, as a result of centrally located lung tumors. Trauma, rib fractures or irritation from chest tubes used to drain air or fluid from the pleural cavity in the chest. Certain drugs that can cause lupus-like syndromes, such as hydralazine, iprazoline, Procon, Pronestil, Procanesar, Procanbid. These brands no longer are available in the US, phenytoin, Dilantin, and others. Abdominal processes, such as pancreatitis, cirrhosis of the liver, gallbladder disease, and damage to the spleen. Pneumothorax, air in the pleural space, occurring spontaneously or from trauma. Sign and symptoms. The following are possible symptoms and complications that may be present when pleuritis is affecting the individual. Shortness of breath, cough, fever and chills, breathing issues, unexplained weight loss, sore throat, pain and swelling of joints, collapsed lung. Cyanosis. Diagnosis. History collection, a history of pneumonia, chest tumor, cardiac, renal, or liver impairment and cancer-related treatment. Physical examination, decreased or absent breath sounds, decreased fremitus, and a dull, flat sound when percussed. Chest X-rays. Chest X-rays will allow us to see if there's any inflammation in the lungs. Physician may also order a decubitus chest X-ray, which is an X-ray taken while patient is lying on his side. This allows free fluid to form a layer. A decubitus chest X-ray should confirm if there's any fluid buildup. Blood tests. Blood tests can help to determine if patient has an infection and determine the cause of infection. In addition, blood tests will reveal if patient has an immune system disorder. Thoracentesis. During a thoracentesis, the physician will insert a needle into the area of the chest where imaging tests detect fluid. Next, the physician will remove the fluid and analyze it for the presence of infections. CT scan. To further research any abnormalities found on chest X-rays, the physician may want to take a series of detailed, cross-sectional images of the chest using a CT scan. The images produced by the CT scan create a detailed picture of the inside of the chest. This allows the physician to get a closer look at the irritated tissue. Ultrasound. In an ultrasound, high-frequency sound waves create an image of the inner portion of the chest cavity. This will allow doctor to see if there's any inflammation or fluid buildup. Biopsy. A pleural biopsy is useful in determining the cause of the pleurisy. The pleura is the layer of membranes that surrounds lungs. During the procedure, the doctor will make small incisions in the skin of the chest wall. Next, the physician will use a needle to remove a small tissue sample of the pleura. This tissue will then be sent to the laboratory to be analyzed for infection, cancer, or tuberculosis. Thoracoscopy. During a thoracoscopy, the doctor will make a small incision in patient's chest wall and then insert a tiny camera attached to a tube into the pleural space. He or she will use the camera to locate the irritated area, and then collect a tissue sample for analysis. Management. Eye medical management. Antibiotics for bacterial infection. Over-the-counter medicines, including aspirin, Bayer, ibuprofen, Advil, or other non-steroidal anti-inflammatory drugs. Prescription pain and cough medication that may contain codeine. Medications to break up any blood clots or large collections of pus and mucus, e.g. streptococcus, urokinase. Bronchodilators via metered dose inhaler devices, such as those used to treat asthma, e.g. salbutamol, Budecort. Individuals with large amounts of fluid in their lungs, pleural effusions, might have to stay in the hospital with a drain tube in the chest until fluids drain adequately. 2. Nursing management. Nursing diagnoses. Ineffective airway clearance. Ineffective breathing pattern. Impaired gas exchange. Acute pain. Activity intolerance. Anxiety. Ineffective coping. Expected outcomes. Demonstrate energy conservation techniques, express feelings of increased comfort and relief of pain. Verbalize strategies to reduce anxiety. Maintain adequate ventilation and oxygenation. Maintain a patent airway. Maintain a respiratory rate within 5 breaths of the baseline. Use support systems to assist with coping. Nursing interventions. Monitoring. Vital signs. Respiratory status, including respiratory rate and depth and lung sounds. Intake and output. Pain level and relief. Cough. Give prescribed drugs if cough is present. Administer acetaminophen with codeine as ordered. Encourage deep breathing and coughing and use of an incentive spirometer. Have the patient splint the affected side. Assist patient to a position of comfort, possibly lying on affected side, to decrease stretching of pleura. Ensure a patent airway. Encourage use of non-pharmacologic pain relief measures, such as heat, progressive muscle relaxation, and guided imagery. Position the patient in high Fowler's position to maximize chest expansion and ease the work of breathing. Auscultate lung sounds. Administer oxygen, if ordered, based on oxygen saturation levels. Assess for signs and symptoms of hypoxia when anxiety, restlessness, and agitation of new onset are noted. Provide for frequent rest periods. Cluster care activities to allow frequent rest periods. Assist with passive range of motion, roam, exercises. Encourage active roam exercises. Provide comfort measures. Assist with thoracentesis, if indicated. Encourage the patient to verbalize feelings and concerns. Provide emotional support and guidance. Assist the patient in using positive coping strategies and relaxation techniques.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.